Hello, today our group is presenting treatment strategies for a patient with drug and alcohol abuse. Our patient, Chris, is a 42-year-old male with binge drinking, occasional cocaine use, and methamphetamine use 2 months ago. He reports dry mouth, sensitivity, heavy plaque buildup, and comes in today complaining of a toothache. He has a history of missed dental appointments and signs of alcohol-related gland enlargement. Let's take a look at some strategies that allows a dental hygienist to provide safe, comprehensive care and support patients struggling with drug and alcohol abuse. Research shows that even brief supportive conversations like this can reduce harmful substance use. Recognizing signs such as missed appointments, alcohol in the breath, or gland enlargement also helps the clinicians identify at-risk patients.
Chris? Hey, come on in.
Hey. Listen, I deserve an award or something because I could not find this building and I circled this parking lot like 4 times. Crazy.
You made it. That's the hardest part. Well, besides flossing. Let's get you checked in.
Flossing? Probably floss like twice a year. Usually just when something's stuck.
Mission failed. We'll get them next time.
Twice a year is better than 0. Before we start, I want to ask you a few questions so we can treat you safely, okay?
Okay.
All right, Chris, how many drinks do you think you have per week? You can be honest.
I drink Friday, Saturday, and then sometimes Sundays if the Cowboys are losing.
Okay.
So basically every weekend. Yeah.
Got it. And how many drinks does weekend mean? 1, 2, or I lost count and I'm singing karaoke?
And
Well, it starts normal, then somehow I'm at Whataburger at 2 in the morning. That's all I'm gonna say.
Thank you for being honest. What about the weekdays?
If work is chaotic, I'll reward myself. So.
Okay, thank you for being honest. Life can be hard. Now with your cocaine use, have you used any recently?
Okay, yeah. A couple of days ago, but don't judge me. I'm trying.
I'm not judging you at all. I just need to know because the numbing agents that we use is called epinephrine, and mixing cocaine in your bloodstream with the epinephrine that could possibly get in your bloodstream, it's like mixing Mentos and Diet Coke.
Put the lid back on.
Yeah, let's not do that.
Yeah, I agree. Okay, good plan. And so then also on your health history it says possible methamphetamine use, is that correct?
No, I tried once months ago and I hated it. I like my teeth too much to lose them on purpose.
Okay, 1 month. What worries you about your drinking or drug use?
My teeth look tragic. I smile and it looks like I chew on rocks.
That's something we can work on together. If you ever feel like you want more support for cutting back, I have plenty of resources and information I can give you, and we'll revisit the topic throughout the treatment if you're okay with that.
Okay, sounds like a plan.
Okay.
Substance use influences treatment planning. Safety measures include avoiding vasoconstrictors, delaying complex procedures until medically stable, and monitoring for oral cancer, especially in alcohol users.
Okay, Chris, we're gonna talk about what I see in your mouth. So I see some early sets of decay, some plaque buildup accumulation, and some dry mouth. Does this sound correct?
Yeah, I try to drink a lot of water, but my mouth is like, nope, try again.
Well, alcohol does contribute to dry mouth, so does stress. So I'm going to recommend a couple of things that might be helpful for you to stimulate the saliva. When we don't have saliva, it's faster for those cavities to grow, okay? Okay, so I'm going to show you my hygiene recommendations. First of all, some xylitol gum or mints 3 times a day would be good for stimulating the saliva, as well as a saliva substitute rinse like Biotene. And we want to make sure if we are using a mouth rinse that it does not contain any alcohol, because that will dry it out even more. Also making sure we sip water instead of energy drinks throughout the day, okay? Does that sound good?
So, no Monster at 8 a.m. anymore?
Yes, it'll be very important for your teeth and getting rid of that dry mouth. Okay, so we are going to place a fluoride varnish. That's going to be good for your teeth. And then I'm also going to send you home with a fluoride prescription strength toothpaste today, okay? This is going to help strengthen your enamel and slow down the decay.
Good. I don't want any more cavities.
Okay, good. Alcohol raises the risk of oral cancer. At every visit, we're going to make sure we do a cancer screening. Okay, some areas we really want to take a look at is the floor of the mouth and also the side of the tongue.
Seriously, alcohol does that?
Yes, especially when combined with dry mouth or tobacco, but catching these signs early is the best prevention.
Substance use patients benefit from frequent recare every 3 to 4 months due to high caries risk, inflammation, and oral hygiene challenges.
Hi Chris, my name is Kika. I'll be helping you out today. I just reviewed your health history and I saw that you had cocaine 2 days ago. Do you want to talk about it?
I mean, not really, but here we are.
If you use cocaine within the 6 hours, we can't numb you. Since it has been 2 days, we can treat you, but no epinephrine. So today for the treatment, we'll be using mepivacaine, which has no epinephrine. So there you'll have a little comfort while I'm cleaning. And if you have any questions, just raise your left hand for me.
Okay. I support whatever keeps me from dying in the chair.
Same. Now, what about meth? Any use in the past days?
No, I learned my lesson on that.
Okay. Now let me ask about how do your gums bleed when you brush?
Yeah, a lot. But I just thought that meant that I was trying really hard.
That could be related to the inflammation and not good brushing technique. Alcohol can mess with the way your body clots, which is why we are taking extra precautions in creating your dental hygiene care plan today.
In today's appointment, we walked Chris through every step of his care. We reviewed his alcohol and drug use to keep treatment safe, adjusted his plan to avoid complications, and created a personalized approach for managing dry mouth, plaque buildup, and early decay. We also completed his oral cancer screening and scheduled him for a 3-month follow-up to keep him on track.
Thanks for watching.
Body clots, which is why we are keeping today Loki, and I had to
Wait, what's her name?
Okay, I'm just gonna be still.
Sorry.
that you have
Cocaine use and methamphetamine use 2 months ago.